You're live.
Okay, hi everyone. This is Peggy Demetrio, owner and nurse practitioner of Cubita Health and Wellness, medical and aesthetic practice in Wesley Chapel. Thank you for joining us for Facebook Live. We're going to be doing a demonstration today on two products that we commonly use in our practice, Radiesse and Xeomin. We've been in practice for about a year, but I've been injecting for about 9 years. All kinds of products. We offer from the Juvederm line to the Restylane line, and also now the MERS line, which is the Xeomin, Bellotero, and Radiesse, which we love to use to help with volume and for the fine lines. And this is our model, who's from Bliss Facial Spa Wesley Chapel also, who's kind enough to help us with the demonstration. So we started out with a consent that was signed. We reviewed possible risks, which are bruising, swelling, as the most common type of things. And we're going to start with the Xeomin first, which is a purified neurotoxin, the most purified of the three that are out there, meaning Botox and Dysport. So we just find it's very long lasting and can help in even resistant cases because it doesn't have preservatives in it. So we're just going to start by just cleaning and alcoholing the area.
And what area are you treating?
We're going to start the Xeomin with what we call the glabellar. This is what you call the scowl lines or kind of frown lines. You want to make that face for us? Yeah. So over time, those lines become more prominent just from regular use. So,
too much scowling.
Yes, if you're serious, concentrating, some people do it a little more than others. So that's one of the most common areas that we use neurotoxins for. Can I get one more alcohol?
And how long can she see results for?
Results are not going to show immediately, usually 3 to 7 days for most people. Some people even up to 2 weeks, but that's not common. We also have crow's feet that can develop on each side of the eye, so we usually put a few units in there as well to help calm those muscles down and smooth the area. Do you have a gauze also?
And how long would it last her?
So it'll last usually 3 to 6 months, depending on the person. So maybe do that scowl for me. Wonderful. And you can rest. That's how I see how her muscles are pulling. So I'm going to do the first one. Not too bad?
Not bad at all.
Great. Scowl for me again. And great. Relax. Perfect. Alright, so we just did 3 areas, main areas that we do to tone those muscles down. Do one more for me because her muscle looks pretty strong. Rest. So that will take care of this glabellar area. If it's not injected correctly, it can cause problems such as lid drooping, migration of the product. So you always have to make sure you go to a skilled injector. Now a lot of clients like also getting a little bit of a brow lift as a result. As we get older too, sometimes the lids can start looking a little creepy and coming down, so injecting specific areas will end up in a bit of a brow lift. So most women actually ask for that. So maybe you turn a little bit towards me and then raise your forehead for me. Perfect.
Why do you like being an injector?
Oh, I love being an injector. You know, I spent years, and still do, raise your forehead for me, rest. You know, helping people improve their health, their overall well-being. But there's more to that. There's your mental health as well. So if you feel good, you look good, then that affects your overall well-being as well. And that's what procedures like this do for people. I'm going to use 2 more units of the Xeomin. You mind drawing that up for me? Just to balance that out.
to the
But
T.
no, I love it. And people leave happy, even though you can't see the results of the Xeomin yet. Once we get to the filler, you'll start seeing an immediate improvement in
To
the
the
volume
10.
lost. Yeah,
To the 10.
to the 5.
To the 5.
Just one more spot. Catherine's kind enough to help. We work together in our office. Say hi, Catherine. Hi. Perfect. And then once we finish that area, we'll go to the sides. Wonderful. If anyone has any questions, feel free. If I'm in the middle of my thought, I will answer you as soon as I'm done, but I would love to have any questions.
So what's the average number of units in the area you just did?
In the glabellar area, average number for Xeomin can be anywhere from 6 to 15. It just depends. I find that males need even more because that muscle is so much stronger. The forehead can be quite a bit more. I didn't do as much for you. I only did about 10 units to your forehead. But I find that 20 units is common, in some cases 30 units. It just depends on the person. So for crow's feet, also depends on the product. Yours are not very visible when you do like a squint. Can you see it on that side? You see these here. So by putting the Xeomin in here, it's going to end up just leaving a smoothness. So then over time, it's going to get smoother because she won't be able to make that full motion. But it doesn't take away from expression. She'll still be able to express because people sometimes will say, oh, well, I look like a statue. Will I not be able to express? But you can. What does it feel like, Becky?
I hardly feel it at all.
Awesome. That was great.
It's like somebody's taking a pen and poking it just a tiny bit. Not even.
So, not bad.
So
right?
no burning.
So do the squinting again. A little stronger, like you're really excited. Okay, good. So we're just doing about 6 units on each side to this area. Again, it can often be a lot more.
You're
but-
using different needles too, right? Instead of the same one for.
Yes, I'm changing. Yeah. I have it per section.
Really
So we did different ones for each eye, different for the glabellar. So that's it for her Xeomin. Done. So not bad, wasn't painful.
Not at all.
She can actually go back to work, do what she needs to do. Precautions that we tell people the day that they have any type of neurotoxin is don't massage it. Try not to bend forward too often. For the next 3 to 5 hours, we want everything to stay where we've done it. Avoid alcohol, any type of blood thinners, aspirin, Aleve, ibuprofen, any one of those.
I've also heard don't lay back. Is that true?
Don't lay,
back.
yeah, there's mixed. The rule used to be don't lay flat for 3 to 5 hours. Newer research is showing they're not really finding any major complication from that.
Okay.
I still tell people that, don't lay flat and don't bend forward for that period of time, but we haven't really found any negativity from that. So now that we've done our Xeomin, we're going to go to the folds. This is the fun part because you can see some instant results from this. Now we did apply numbing cream prior, so that's been sitting a good 15 to 20 minutes.
Yeah, I can't feel my lips.
So what kind of filler are you using?
So we're going to use Radiesse.
Okay.
Radiesse is a filler comprised of these calcium hydroxyapatite little microspheres, and they're suspended in a gel. So when we inject them, you get this instant volume in the areas that we're doing, and then over time, collagen is stimulated, and that ends up filling that area as well as the product is dissolving in 12 to 18 months.
So you get quite some time out of this. Yeah.
Quite a bit, yes.
That's awesome.
Common side effects of something like this, of the Radiesse, would be swelling, probably the most common. You can bruise. Some people are just more prone to bruising than others. She's already had some volume in her cheeks previously. Otherwise, when we look at nasolabial folds, we tend to address the cheeks first. It's because the reason you have them is because of volume loss in the cheeks, and the bones also, you get volume loss from your bones as well over time. So, but she's already had some there, that's why she still has that pretty volume in the cheeks, but we're still going to decrease what she has left of the lines. Alright, I'll take the radius. Some people end up needing a syringe on each side. Some people, I can use a full syringe on everything. It just depends. Radiesse tends to have a larger size syringe than some of the other ones. Instead of 1 cc, it has 1.5. So you can get away with one syringe covering more areas. Thank you. All right, so I'm gonna have you sit up a little bit first. Did we get a before picture?
Well, we're not live.
Just so we can do like a side by side.
You might want to take an actual picture.
I can take a picture real quick.
Yeah, I would take
Yeah,
one.
take one like
I would take one.
On the side, kind of.
one on the side is good and one from the front. In our office, we do it against the black background, and then we'll do a comparison 2 weeks later. But we'll make do today.
Yeah.
Yes.
You gotta do what you have to do.
Yeah.
Perfect.
Perfect. And then in a couple
Good
weeks, we can
photos.
put up a comparison also. So when she's sitting up, you can see the depth a little bit more. So I'm going to do the procedure while she's lying back, and then we'll have her sit back up again. So everyone usually has one side that's deeper than the other, completely normal. People come in and they'll say, oh, my one side is worse. I go, yes, everyone's is completely normal. This product is also mixed with lidocaine. So the more injections I do, the more numb she gets.
Nice.
Yeah.
Awesome.
You ready? All right. We're going to stop down low and work our way up. Not too bad? Tolerable?
Yeah.
Little bleeding, normal. Did you take any blood thinners, aspirin, anything like that this morning?
Mm-mm.
So even
My
if you
blood's
don't,
normally thin for some reason.
some people just bleed a little more. That's normal.
If they're on blood thinners, how long can it come off?
If you're on blood thinners, you should stop them a good 3 to 5 days prior to the procedure. When people call make an appointment, we do let them know that. I've had cases where we'll do it and they go, oh, I forgot to stop it. And we're like halfway done. So, but most of them do okay as well. Yeah, they do fine. It's just they may bruise more. That's the main thing. And then we have periods of this where we're like holding and waiting because it's kind of hard to inject with the bleeding. We have more alcohol, right? Definitely can use a little more. And I'm just going to gently rub it and massage it in also. You don't want to completely obliterate this fold because then that looks unnatural. So you want to soften it, but you don't want to completely obliterate. I've had people say, oh, I can still see it. We're supposed to. Just not as much as before.
When someone wants to know, does it hurt?
Somebody asks, so this isn't hurting
No.
right now?
When you first put it in, it hurts a little, but not for very long and not bad.
Does it seem like the more I inject, the less pain or the more numb you are?
Mm-hmm.
Where else can you use Radiesse?
Where else? You can use Radiesse besides the nasal labial folds, use marionette lines. We also use them in the cheeks to add some volume into the cheeks. And a really fun area we've been doing is the hands. It's the only filler right now, FDA approved, to fill the hands, so to diminish fine lines, veins, just the looseness that occurs over time, and that lasts sometimes up to 2 years.
That is crazy. 2 years?
Yes.
Wow.
Yes.
That's amazing.
It is. The results are just beautiful with the hands. I have a lady coming in today who did her hands a couple weeks ago. I can't wait to see them. So when I saw her again last week, it looked great. She didn't bruise, barely swelled, so it was great.
People always say you can always tell a woman's age by her décolleté, her
Yes,
neck, and her hands.
exactly.
Right?
Yeah.
So that's awesome that you can actually put it in your hands.
Absolutely. And you're right, you mentioned décolleté. There is an FDA-approved device that we do as well called Ultherapy, which is a one treatment for the décolleté, the neck. You can do it in other parts of the face as well, but the décolleté is common, and it lasts 2 years. And you get a tightening of the neck. It's beautiful. So you have that option as well. Anytime you combine a device with a filler, you get better results. So if you tighten up, let's say, the neck, then you get a tighter jawline. And the décolleté, you can get like creeping in between. It tightens all of that right up.
Yeah, especially a lot of people who are side sleepers. I always get those
Yes.
from ladies, right? I sleep
That's
on my
exactly
side, I
it.
get that creping effect.
It's hard to sleep on your back the whole night.
It is.
So you don't see much for bleeding, bruising. I mean, she can go back about her day after this. This side looks like it's going to be a little less than the other one. As you can see, the lines weren't as deep. Keep in mind her left side was deeper. Usually that's the side that gets more sun in the car from driving. So you get more sun damage on that side.
And we have a 2 client at 12:30, I think.
Still doing okay?
Mm-hmm.
Great. So I'm going to have you sit forward for me just for a moment. Like sit up a little bit. Okay. So I wouldn't want to put more because then it's going to become a bit unnatural. So good.
Can I smile?
You can smile. You should be able to have normal movements.
Okay.
Absolutely. So good. So I'm going to have you lay back. Now we're going to focus on what we call the jowls or marionette shadowing. Some people, they're actual lines. Hers are not really lines. It's more of a shadowing. That part definitely changes, like your bones change in that area. You start getting less bone over time. And because of that, it just appears a little bit looser and more hollow. Take another alcohol wipe. There's all different ways to approach it from an injector standpoint. You just don't want the client to be left with what they call like monkey jaw. If you've ever heard that term, they look like they have 2 balls here over time.
That would be horrible.
Definitely
that,
seen
yeah.
that. So you definitely need some expertise with that.
Does that go away, or does
Once
that
the filler dissolves,
takes time? Is there something you can do though in the process?
depends on the filler. If it's an hyaluronic acid filler, it can be dissolved.
Okay.
Yeah, if it's a very long-lasting filler, like something that like Radiesse, time.
Time.
Yep.
Be your new friend.
Yeah, time. All right, so we're gonna take this approach here. You ready?
Wow, you can really see a difference already. That's amazing.
It is. Barely bled at all. A little bit more in this area. also will bring up the creases in the lips because those start to fall eventually also. So sometimes I do one side and one lip will be
That's
up.
really cool.
Yeah.
I don't make it look too much different.
Oh yeah, I'm feeling a friend. And these are subtle differences that somebody may not know that you had anything done. They'll just, what did somebody tell me the other day? We did her cheeks and she said, I went to work and everyone told me my face looked hydrated. I go, okay, good. So they didn't know what it was. They just knew you looked good.
Or you got a haircut.
Yes, or a haircut. That's one of those beauty tips. If you're going to do something drastic, get a haircut also. And then people will think it's your hair.
Yeah.
Yeah, so that's just one of those beauty tips.
Great. I have noticed, and I'm not sure if it's the same, but people have come and gotten fillers in their cheeks. And you
Yes.
feel a nodule in there. Is that with all fillers, or is
It's a potential side effect with all fillers.
okay?
But it really shouldn't happen most of the time because if it's injected correctly and the injector is experienced, it sits on the actual bone. When we do cheeks, it sits on what they call the zygomatic arch. So if you're deep enough on the bone and we feel properly, you know, when we're finished, there shouldn't be any lumping. If it's not injected deep enough where it's supposed to go, then you're gonna lump.
Yeah, because I felt it. It feels like almost like a cyst is in there.
Yeah,
It's
that's not
it's
normal.
Just a filler.
Yeah, not normal. If somebody had that and came in, I would probably dissolve that. Especially because sometimes on profile pictures, you can see the like waviness in their cheeks. So not something that should be happening.
Okay.
No, it's easy to prevent that. I mean, that's really a technique issue. Can I have a little more alcohol? I'm gonna add a tiny bit more on this side, then I'll move to the other. Yeah, fine. Just a little bit in here. So you see a slight difference there?
You see a big difference, actually.
Yep. Just to give her that volume that was already there before.
So if I have like a deep line, the crease,
In the chin,
that work
yeah, so
there?
we call this segmental. A lot of people's line becomes deep too with the structural changes that occur. We can fill that too. Yeah, usually I'll go in and just fill in the submental crease and reduce that. That can be done in some people when we're looking at profiles. Their chin is kind of coming in and shrinking as well. And then these are a lot of off-label things that we do, like you're not going to see specific FDA approval or labeling for them, but we do it. Sometimes we'll increase the volume in the cheek as well to help with the profile, or in the chin, I mean. So that's another thing we can do and have done. You ready? You can go to your meetings and be totally fine today.
It looks really good.
We still recommend ice afterwards. You can still get some swelling later.
Okay.
So if you choose ice on and off throughout the day.
Do
it'll
most
be
people
fine.
bruise, or is it just mostly like Vicky today? Like they just kind of
Most of them are like that.
Okay.
Yeah, I have some people that bruise. They bruise with everything, and no matter who does it, because I'll say, "Gosh, you know, have you bruised before?" They're like, "No matter who does it, I bruise."
Okay.
So I have that, but I would say most people are like Vicky. They don't bruise much,
Okay.
or at all. Have you sit up a little bit? Perfect. Sorry. Sorry, just take a look, make sure. I'm gonna just a tiny bit more, and then that's it. Just a little bit more here. Okay. Yep, like that. And then you'll be good. And this will be, it's almost like when you hear people say rejuvenation, It's more of a rejuvenation because not everyone can really tell what you had. But we have a trained eye and we can say, okay, if you improve your jowls, her overall appearance will look, younger, more youthful. That's what we're trying to do. And I'm feeling for lumps also. I had this question regarding lumps. I don't feel any lumps.
Okay.
If I did, at this point, I could smooth it out. Because sometimes when you're injecting, you may inject a small little clump, and then you just smooth that right out. This product allows you to do that easily. Now, fillers, they don't settle immediately. So Radiesse can take 3 to 4 weeks to fully settle. So and that's when it kind of links in and attaches to where we need it to. So it's good try not to sleep directly like on your sides tonight. Sleep on your back if you could, and ice throughout the day.
And it really didn't hurt. I was afraid of fillers, but it didn't hurt at all.
Good.
Wow.
So no burning sensation, nothing like that?
So nothing burning. Any way to describe it? I mean, it was just like a mild poke.
It's like a vaccination. You put it in, you feel that initial little, and that's it.
That's it.
Awesome.
Good. So that's it. So that's just for like a natural rejuvenation. This, like we said, 3 to 5 or 3 to 7 days, your Xeomin will kick in, and then you'll have that smoother appearance all the way around. You already have volume to your cheeks. If she was to have more fine lines, some people have just like little cut type lines. We have a product called Pelotero that we use in conjunction with Radiesse to fill those in also. So a lot of times you fill it and then you finish it with the Pelotero with those fine lines. So also works great. So we have so many options. We do free consultations at our office because a lot of times people will come in thinking they need one thing, but they need something else. Like we were talking about, everyone thinks they need Botox, and they'll say, I need Botox right here. I'll go, that's a fill. That's a filler. And oftentimes it's a cheek filler. So the purpose of the consultation is to see what concerns the client and then tell them what would actually work for them.
And how can they reach you?
So they can reach us a couple different ways at Qvita Health and Wellness. Our office number is 813-501-4130. Again, it's 813-501-4130. On our website at www.qvitahealthandwellness.com, we have a list of all of our services, and also you can make an appointment from the website as well. So you can just go right on, see our schedule, and plug yourself in, whatever works for you. Awesome. Any other questions? Anyone may have? You did amazing.
Thanks.
Those after pictures.
Yes,
Yeah.
let's get some afters for sure. Yes. Thank you so much for joining us, for tuning in, and we'll post some after pictures in a couple weeks as well. So you can see some sustained results.